Good, happy Thursday evening, November 19, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Thursday evening, so let's begin. First up, we're going to begin with COVID-19 updates. Coronavirus in New Hampshire, key information and data. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 16,278 number of people in New Hampshire have tested positive for COVID-19. 11,647,930 number of people in the United States have tested positive. 506 number of deaths from COVID-19 in New Hampshire. 822 number of people have been hospitalized with COVID-19 in New Hampshire, and 756 number of deaths from COVID-19 in the United States. And now let's take a look at this map of New Hampshire where current cases of COVID-19 are. Manchester, 446. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Manchester, 2958. And now let's take a look at these three charts here. Let's start with the first chart here. New cases each day, New Hampshire in the purple. Daily new positive COVID-19 cases. In the orange, new hospitalization and red deaths. Let's take a look at this chart here. Current cases in the purple. Total current COVID-19 cases. And in the orange, current hospitalization. Let's take a look at this chart here. Total cases in the purple, total positive COVID-19 cases, orange, total hospitalization, red deaths, and blue recovered. And let's take a look at this chart here. Positive PCR test rate and daily PCR test. Let's take a look at this chart here. Age group of cases, female and male of cases, and risk information. Let's take a look at this chart here. Infections, hospitalizations, and deaths. Let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. Sununu issues statewide mask mandate in effort to slow the spread of COVID-19. Mandate starts Friday, tomorrow, and applies to indoor spaces outdoors where distancing can't be maintained. Governor Chris Sununu is imposing a statewide mask mandate starting Friday in an effort to slow the spread of COVID-19 in New Hampshire. Sununu made the announcement Thursday during his weekly briefing on coronavirus. The emergency order comes as the state has recorded its highest total of current COVID-19 cases since the beginning of the pandemic. This is observantly a decision that didn't come lightly, Sununu said. The emergency order applies to anyone over the age of 5 in indoor public spaces and outdoor when social distancing can't be maintained. Sununu did not say that people would be fined or otherwise penalized for not wearing the mask. He noted that the Attorney General's office has some enforcement authority it has exercised with some businesses, but he said the state will work to educate people on the importance of wearing masks. The order comes as New Hampshire health officials announced 529 new cases of COVID-19, a record over the course of the pandemic. State epidemiologist Dr. Benjamin Chan said there were 4,006 active cases in the state, also a record. Thursday's 4.1% PCR test positivity rate was the second highest rate since the state began reporting it on October 2nd. Officials said there were 98 people hospitalized in the state for COVID-19, the most since June 1st. The number is more than double that it was 2 weeks ago. 2 more Granite Staters have died of COVID-19, officials said. Both were associated with long-term care facilities. We've said all along that mask mandate was always on the table, Sununu said. We were going to let data really drive a lot of our decision. And it was clear, looking at the data, this mask mandate is the best interest for our citizens. Reacting to the news that some of his fellow Republicans were already announcing their intentions to ignore or resist the mandate, the governor said this order is about protecting the community. It's about everybody around you, Sununu said. So the data is clear. If folks don't want to look at the data, I can't force them to listen to reason. But it is clear. It isn't speculation. It isn't conjunction. It isn't a hoax. This is so real, and it is skyrocketing across the country. Disaster loans available as extreme drought area expands in New Hampshire. State officials urge water conservation. Let's take a listen to that video from WMUR News 9, Ray Brewer.
There's a spot.
Not feeling it.
What's wrong with that spot?
11% of the state is into D3, extreme drought, with the rest of the state in D2 or D1.
The recent precipitation did help somewhat, but not enough to slow the expansion of the area, now dealing with an extreme drought.
From Stafford County, we did extend D3 west into the upper Merrimack Valley.
The Merrimack River is down about a foot from where it should be at this time of year. It's still in a better place than it was in August, when the situation was even worse.
But about 400,000 Granite Staters are currently dealing with some sort of water restrictions, according to the state, and groundwater levels are continuing to lower.
This impacts well systems across the state, both for community water systems and for residential wells.
If you're wondering about your individual well, there are some things you can check.
Look around your neighborhood, see what the surface waters look like. Are your ponds low? Are your streams low? If they are, that's telling you that surface waters and groundwaters are falling in your neighborhood.
Other indicators of a problem: changes in water color, changes in the taste of water, and change in the smell. Given the current situation, the state says water conservation is increasingly important.
You should work to make sure that your children understand about brushing their teeth, turn the water off, really simple things like that, to running full dishwashers and full laundry loads.
There is still some time to recharge groundwaters. The ground won't freeze until late December or early January, but at that point, no more water will find its way underground.
Only rivers and streams and ponds that have not frozen on the bottom then contribute to groundwater. And that will set us up in a not good place for going into the wintertime and springtime.
Ray Brewer, WMUR News 9.
Okay, and there you go on that video and that report. Minimal COVID-19 transmission found within schools, health officials say. Officials discuss guidance with school nurses with Thanksgiving ahead. Let's take a listen to that video from WMUR News 9, Charisse LeClaire.
There's a spot.
Not feeling it.
What's wrong with that spot?
On a weekly call with school nurses, state health leaders giving a breakdown of the numbers of COVID cases across schools. 530 people, staff and students in K through 12, have come down with the virus in the last several months, impacting 230 schools. There have been 17 clusters in non-residential schools, with 85 people involved in those clusters, averaging 3 to 8 cases for each.
Despite the hundreds of students and staff with COVID-19 potentially exposing other persons in K through 12 settings, there has been minimal transmission within schools.
And although the state is seeing higher case numbers,
if a school has the staffing and they're maintaining operations with low school impact, despite increasing levels of community transmission, schools can very reasonably, and we encourage them to try and maintain some amount of in-school learning and operations.
DHHS says it will continue prioritizing contact tracing for certain populations, including children, and is considering testing options for staff.
I think it's a very good suggestion that there's a spot for staff to go for testing so that you can get those persons who are symptomatic tested quickly and then not have to wait for the results to come back. So I do know this is under consideration.
Okay, and there you go on that video and that report. U.S. jobless claims rise to 742,000. Millions will soon lose aid. Let's take a listen to that video from Associated Press and the National Desk staff.
There's a spot.
Not feeling it.
What's wrong with that spot?
A tragic financial picture during what's usually such a joyful time. The need for relief so dire 12 million people stand to lose federal benefits the day after Christmas. The study from progressive think tank The Century Foundation, who predict absent congressional action to extend CARES Act benefits, December 26 will mark the end of one of the last lifelines available to millions of Americans in desperate need. The study estimates 7.3 million people will be kicked off the pandemic unemployment assistance program by year's end. The Hill points out once the pandemic emergency unemployment compensation program ends at the end of the year, 4.6 million workers will lose benefits. For those 4 million lucky enough, some state-level programs will continue. Despite Speaker Nancy Pelosi and Senate Majority Leader Mitch McConnell calling for some form of relief, there's no deal in sight.
Okay, and there you go on that video and that report. Updated CDC guidelines. Don't travel for Thanksgiving. Let's take a listen to that video from WMUR News 9.
19 cases continue to rise in New Hampshire and across the country. There's growing concern about what might happen for the holidays as people gather together. Thanksgiving is just a week away, and many people are asking for advice when it comes to having extended family over to celebrate and whether it's a good idea to travel, even within New England. So to answer some of those questions, we're joined now by Dr. Benjamin Chan, New Hampshire State epidemiologist, to talk about staying safe next week. Dr. Chan, thanks for joining us. First off, can you give us an update on where COVID stands right now? We know that we've had about 30% of all of our COVID cases for the entire pandemic just this month.
Yeah, so most states across the country are experiencing a new surge in this pandemic, including New Hampshire. You know, we began to see an increase in the number of infections going back to the beginning and middle of September, but it's really been the last 2 to 3 weeks that we've seen a dramatic increase in infections in New Hampshire. And the entire state right now is experiencing very high levels of community spread. It's not just the number of infections that are going up. We're seeing hospitalizations and the number of people dying from COVID-19 increase. The test positivity rate is going up. And so all of this points to increasing risk of COVID-19 within our communities.
All right, along with that, what are the health and safety recommendations for Thanksgiving celebrations, traveling, and having relatives over?
Yeah, so any travel and any social or family gathering is going to increase a person's risk for getting infected and spreading COVID-19. that can put families and individuals, but also communities at risk from COVID-19. And so for this reason, New Hampshire Public Health and the U.S. Centers for Disease Control and Prevention are recommending that people make some difficult sacrifices and choose to only celebrate Thanksgiving and gather with others that are from a person's immediate household. We also want people to avoid any travel where possible, even if that travel is only within New Hampshire or New England, because the act of traveling itself is going to potentially increase a person's risk for COVID-19. There are alternate ways that people can celebrate Thanksgiving, such as through video chat. It's obviously not the same, but these are some of the tough choices we have to make this holiday season.
All right, so if people do decide to get together and see each other physically, is there any ways that they can do that safely?
Yeah, so we absolutely understand that connection with family and friends is important. It's important for someone's emotional and mental health. But we want people to be safe and minimize the risks of COVID-19 if they choose to travel and if they choose to gather with people outside of their household. First, when people are traveling, they should obviously pay attention to other states' guidance and restrictions, such as mask requirements, testing requirements, quarantine requirements. If people are traveling out of the state, they should be avoiding any public mass transportation like buses and planes and trains if at all possible, and then minimizing exposures to other public settings and making sure they're wearing face masks when out in public areas. And then with gatherings, the same principles apply that we talk about on an ongoing weekly basis. Keep any gatherings small. The more people, the more risk. If possible, look to host gatherings outdoors, and then when around other people, try and maintain 6 feet of distance, wear cloth face coverings. The same principles apply. We have been asked about testing, and can testing help, and can testing be used? And it can be looked at as one layer of protection. So, people can look to be tested for COVID-19 within several days before travel and then several days after traveling and returning to New Hampshire as one step to prevent COVID-19 risks. But it's important to keep in mind that's only a single snapshot in time. It doesn't completely eliminate the risks of COVID-19. And so it's still important for people to be practicing the social distancing and the face mask use and good hand hygiene.
All right, State Epidemiologist Dr. Benjamin Chan. Dr. Chan, thank you for your time.
Thank you.
Okay, and there you go on that video and that report. Gardner to seek a 23rd term as Secretary of State, praises local election officials. Record turnout. The nation's longest-serving top state election official was first elected by state lawmakers in 1976. And Secretary of State Bill Gardner said Thursday he will seek a 23rd two-year term in office. Gardner is 72 years old. And let's take a look at that U.S. stock market and see how U.S. stock market closed for this Thursday evening. And here's a check of that U.S. stock market for all of you. Your Dow Jones Industrial Average closed in the green and went up. Your Nasdaq closed in green and went up. S&P 500 closed in the green and went up. Gold closed in the red and went down. Oil closed in the red and went down. U.S. 10-year closed flat. Euro/USD closed in the red and went down. And VX closed in the red and went down. Stocks rise as Wall Street turns to tech for safety aimed increasing COVID-19 cases. Stocks closed slightly higher on Thursday as traders increased their exposure to major tech names amid a rising number of coronavirus cases. And that does it for this evening edition of the Riley King Newscast, right here on the Riley King Network. Thank you for watching this evening edition. Have a great rest of your Thursday evening, and I'll see you back here tomorrow for another newscast. I'll have a news report coming up in a little bit. Good night and goodbye, everyone.